communities, our media, and our elected representatives. Emotional support. This will happen when children affected and living with HIV and AIDS receive psychosocial support. We need to train child counselors and revise and update existing guidelines on counseling. Child support groups. This will happen when local communities and panchayat will establish child support groups at the community level. Dignity in daily life. This will happen when we reduce stigma and discrimination by making a difference in the attitude of their friends, fellow students, and the society. And 5 demands from government are involvement and participation. This will happen when state and central governments create the mechanisms and make it a habit to consult children on policies and programs. Increased manpower. This will happen when we strengthen the institutional capacity for training and have more skilled people who can provide home-based and institutional care. Economic support. This will happen when governments evolve schemes for adequate and need-based financial support to parents and caregivers and affected children. Quality and friendliness in services. This will happen when governments set up quality standards and monitor services provided to children independently and regularly. Freedom from violence. This is extremely important. This will happen when we empower counselors and other caregivers to address violence against the affected children. So please take them seriously and support their cause. And my request and my expectation from the media is that please support us and be our partner, because all of you are so powerful and you do report on HIV, but do a bit more and be our partner in sensitizing all the players in this field, all the stakeholders in this field. I'm sorry I was feeling a little unwell, but I mean the cause is much more important than I am. So please, this is my request. All of you are here. Take this message outside of this room and please work towards it, because there's so many people out there. I wish I could share each and every experience that I've had with them. It's such a humbling experience. It's such a humane experience, and they're so courageous, these little children. So please help us and sensitize our cause and take it forward. Interdependent, we need everybody here, because as I said, 1,500 centers are just not enough for ABTCT. We need many more all over the country. We need everybody, everywhere, district-specific program, not just at the metro level, but even in the interiors. We need to spread this message. Ashok just said there's a lot of stigma at that district level, at village level. Unawareness is there. Yesterday we met with girls who got infected after they got married at the age of 17. They didn't have a clue. So they need to know. So we need your support. We need media support. We need television support. We need to reach every household with our message. So as Mr. Fine said, that we need to speak up a little bit more openly about sex, since at the moment that is how it's spread, and then mother to child, the way it is spread, number one, and what we can do to prevent it, like condoms. We have to be open about it, and we need to not sensationalize, but sensitize and handle it properly. And it's not make it about individual and call it a publicity stunt or anything like that. We need to understand the importance of it, because if we do not do it now, India will slow down. We have made tremendous progress, but if all our skilled workers, all our teachers, I mean, I've seen this happening in Africa, and it is not I mean, we are not just saying this, it can happen here as well. This parent, child-headed families where everybody is dead, only a 12-year-old is looking after 5 siblings. So all these things can happen, but the only way to do is everybody has to get together. It is a disease of interdependence. We can't do it alone. So we need your help. And as you're right, face-to-face, although that is the right way to communicate, but it will be very slow. So we need to have these public broadcasting. The media has to play a very active role.
Can I get in one last question? Sure. One last question and
Messages, message specific, prevention specific, treatment specific messages would work better, because then you're just driving home the point instead of making, that will work also. We have made films like Pimpilinge and Nikhil something, and we have made that. And we continue to, I mean, Ms. Meera Nair has made a film called Open Country. But also, I mean, every way, whatever way is possible, I think we should use everything that we have to address this disease and epidemic and see that it's defeated.